Hi, my name is Sharon Eckerd, and I was asked to do this testimonial in regards to Dr. Angel Morales. I was very grateful when they asked me to do it because I personally think so highly of him. About 3 years ago, this coming April, I was in a really bad car accident. Long story short, I lived in Las Cruces with my fiance, and we were driving down Valley Drive, and I was in the passenger seat, he was driving, and a truck came over into our lane, and so my fiance overcorrected to get us out of the way. And when that happened, we ended up breaking a piece in the front of our truck because we had gone up on a median trying to get out of the way of the other driver. And we ended up skidding across oncoming traffic, and the truck ended up flipping. When it did, I was ejected from the vehicle, my fiance staying in the cab, and after the truck was finished flipping, it actually came down on top of me upside down. So I was pinned from about my torso down. My arms and everything were free, but everything else was pinned. Again, long story short, after my fiance crawled out of the cab, got to me, the ambulance was there. They loaded us in the ambulance, and they were going to, of course, take us to the Las Cruces hospitals, but they don't take severe head trauma as emergencies. So my fiance could not go there. So they ended up taking us to, of course, the next option was UMC, which is University Medical Center of El Paso, So they took us there. And when we arrived, Dr. Morales was the surgeon that was on call. Thank the Lord he was, because I don't know what we would have done without him. As soon as they wheeled me in, I was his patient from then on out. I was extremely fortunate for that. He was an incredible surgeon. I ended up with my left side of my pelvis was cracked. I broke my tibia on my right side, which is the larger bone that goes from your knee to your ankle. A couple cracks in my tailbone, bumps and bruises, regular scrapes, things like that. I'm not belittling my injuries in any way. They were traumatic and very severe, but by far my most severe injury that I had was a soft tissue wound that was on my backside from the truck landing on top of me, and all of that weight being on top of me, it kind of squished me, you could say, to not be too graphic. And my backside is by saying that by not being too personal either in this video. I ended up getting all of my surgeries done with my bones and things like that. And of course, the big question was, what are we going to do with my wound? Because all the surgeons there had never seen anything like it. It was very rare, very severe, and very large. They didn't really know how to approach it. And Dr. Morales came up with a very diligent and proactive medical plan regarding my wound that was incredible. The wound being so deep, I did not know this until I had such a severe soft tissue wound, but a wound that deep can actually heal on the exterior, but you're still left with a pocket on the interior from the wound itself. It won't heal on the inside, which can create infection and all kinds of other things. So what we decided to do was to pack the wound from the inside out so it would gradually grow from the inside out. Well, when we did this, we realized that the way that I had torn, I ended up tearing all of my muscles back there. And so I had no control over any of my waist. So I had no control over my bowel movements coming out. So it was leaking into that gauze and then contaminating the gauze, which was then resulting in contaminating the wound. We knew, as well as the doctors, that this would then lead to an infection, of course, as the result, because it was all getting contaminated. Dr. Morales looked at every option possible. He looked at skin grafts and flap to go over the wound, how they could sew it up, every option possible. But with it being a tear, it also made the situation a lot harder because it wasn't a medical cut that they actually did. It was a tear, of course. So Dr. Morales presented me and my family with an idea that he knew that I would not go for and not like, which I can't even imagine being in his shoes and having to present this to, at the time I was a 19-year-old young girl that was engaged and in college, and he presented me with the idea to do an ileostomy, and he knew I was not going to go for it, which is why I can't imagine the struggle to present it to someone that is not a option that a young person would like to do. If you don't know what an ileostomy is, it's where they actually go in and they cut your intestine at the ileum, which is where the small intestine connects with the large intestine, and they pull it through your stomach on the outside, and they put a bag there so that all of your waste will go into that bag. It actually never reaches your large intestine. It comes right out of the small intestine to the ileum and then goes right into the bag. So it's a poop bag basically. I mean, being a young person and you hear ileostomy, then they explain it to you, it's a poop bag. So he knew that this was going to be really rough for a young girl to be able to accept, and I didn't want to do it at first. And I knew he had gone to so much trouble and he had looked at every option and everything, and this was going to be the best option. So knowing that he was recommending it as the best option and knowing that there really wasn't any more options, me and my family accepted. We accepted the ileostomy, and he stressed me that it would be temporary. When my wound healed and all my muscles came back and grew back together, that we would be able to reverse the ileostomy. It would just be work in the long run to be able to get my body back to normal. And I understood this, and so we went along with the surgery. I spent a couple of weeks in the hospital and then got released, and of course went back for all of my follow-ups and things like that. My wound took about a year to heal. After it was healed, I went back to Dr. Morales and was ready for my reversal, and he agreed. However, he had moved from University Medical Center to another facility, and that facility did not accept my insurance due to me being a New Mexico resident. I had New Mexico insurance, and he was, of course, in El Paso, Texas, so they didn't accept my insurance. He worked with his facility forever. I mean, it took a year for them to be able to accept my insurance, and he saw me for follow-ups, and he did everything that he could. He just could not obviously perform my surgery because my insurance was not going to cover it. Knowing that I wanted to get the surgery done and I was ready to be rid of my ileostomy, he ended up telling me that if I wanted to have the surgery done sooner, that I could go and see two doctors, one in Las Cruces and one in Albuquerque, to see if they were able to reverse it, because he's not in it for the money, and he wanted me to be able to, as the patient, be able to get the care that I wanted as soon as I wanted, knowing that I wanted to get rid of it. And even though I was very apprehensive to go to anybody else because of the incredible care that I had gotten from him, I did. I went and looked at these other doctors, and both of them would not touch me because of my severe wound in the past, and they were both apprehensive of my healing, if I would ever be normal again, whatever that means. So I ended up going back to Dr. Morales, which of course was my original plan and what I originally wanted anyways. And I stressed to him that I wanted him to be able to be the one to do my surgery. He had walked a over 2-year-long journey with me, with all of my injuries and my ileostomy, and it being such an emotional roller coaster. I wanted him to be the one to do it because I trusted him. And he's such an incredible doctor and physician, and he has an incredible bedside manner, and he had really taken care of me and my family through my accident and everything that I went through. And I really wanted him to be able to finish the job that he originally got started with me, with everything that had happened. And he was able to, after a little over 2 years, and he was able to do it. And we were able to reverse my ileostomy, and it was incredible that he was the one that was able to do it. I was so blessed because, like I said, I trusted him so much. We were able to get it reversed, and I did wonderfully in recovery and got released from the hospital sooner than expected, and went back for my follow-ups and all of that, and it worked out incredibly. But this testimonial is about what an incredible doctor he is, and I can't stress that enough. I would refer him to anyone, family, friends, a stranger, anyone. He is incredible and the best of the best. He not only is a wonderful physician and doctor, but he does have a great bedside manner. 2 big things that you need to look for when you're looking for a surgeon is when you're scared, which everybody is scared during surgery or after surgery of the pain or the results or what you have ahead of you. And you want someone that's going to help you through it and be encouraging yet sympathetic of your situation. Someone that you can have confidence in but feel like they're also a person on the inside, so they understand that you're a patient and you're in pain or you're scared. He is that person. I could not have asked for a better person to walk the journey with my family or myself. He was a blessing in more ways than one, and I can't stress that enough. I wish the best for him, and I wish the best for all of his patients. I really hope that the people that see this video see a testimonial for a man that is incredible as a doctor and as a person. Thank you so much for listening to my story.